it's Becca from Core Potentials Academy. So I'm here today to talk to you about dry mouth. It's also known as xerostomia. This is commonly found in people who may have had cancer and their salivary glands have been affected by the radiation or even medication. It can be in many other instances, but dry mouth is a really uncomfortable condition. It's hard to swallow. You have to be very careful about eating foods because things can get caught in your throat. And it's a condition that you must talk to your doctor about. They certainly would give you all sorts of different solutions for that, but I'm going to give you some acupuncture points that you could play with that are known for dry mouth, or should I say mouth conditions. So we're going to start with the ones on the head. So the first one on the head is called governing 20. So it's literally right in the center of the top of your head. So what I want you to do with these points is I would like you to take your finger and I'd like you to just give them a little rub. You could draw figure eights. You could even tap them a little bit. You could stretch them open, right? Or you could even take your hand and you could actually just flip them. Flip it so that you've got one side and then you've got the other side. Now our hands are magnetic, and because we're flipping them, we're actually going North Pole, South Pole, North Pole, South Pole, North Pole, South Pole. So what we're doing is we're actually trying to take the irregular energies that might be flipped around in that particular meridian point. So we're kind of activating it to sort of make sure that it doesn't have any irregular energies, and then we're kind of stimulating it by giving it little figure eights or rubbing it open so that we can increase that point that is very known for many other things, but dry mouth. Okay, so that's one. The next one is literally right underneath our cheekbones. So we have these bones that are right here, but we want to go actually kind of right underneath them with our finger, like we're kind of pushing up underneath the cheekbones. And here we go, we're going to rub them. This is stomach 3. So we can do again little figure eights. We can again, we can pull them open. We can flip our fingers back and forth on them like so, and we can just hold them. If you hold them for a few minutes, you're going to get some energy coming right to them because your hands are magnetic, and you've got this side of the hand is bringing attention to this particular meridian. Okay, so the next one, there's some more stomach points. So we want to go to stomach, let's see, 5 or 6. So 6, we'll start with 6. So 6 is literally like if you took a smile and you came right out to your jawbone, it's right here on, just in front of the jawbone. All right, so same thing, you can rub it with your hands, rub it, right? Flip your fingers like so. And you can just hold. The next one is stomach 5. So that one's literally right on the jawbone, right here, right? So you can literally get these two or all 3 of them together like this, just by holding your hand like this, okay? All right, so now we have actually stomach 7. So the stomach 7 is like right in front of this little flap we have on the ear. It's literally right in front of it. It's kind of on the jaw. It would be where you would, somebody might treat you for TMJ, when you get lockjaw kind of feeling in here, when your jaw isn't opening properly. So this one can be sore. So we, again, we just give it little figure eights, and we flip it back and forth like this to take the irregular energies off, right? And then we can just, again, rub it. So again, you could hold that one. You could have your little pinkies on the underneath side of this number 3. You can go across the 5 and the 6, all these stomach points on the face, okay? So the next one I would like to do is small intestine 17. So it's actually, we have this sternal-mastoid muscle that's right here that comes along the side of the neck. So this is actually behind that muscle. So you're literally sort of underneath the ear and just behind it on both sides, right? So we can rub that one. That one can be sore. And actually, I noticed my mouth is getting spit in it or saliva in it just by doing this. So you can rub it. One of the other great things to do is you could literally do a bit of a jaw move where you kind of get to these points that are right by the ear, and you can just kind of go across that mastoid, and behind you'll be stimulating your vagus nerve, which will help you relax, and you're hitting all those stomach points that are on the jaw, and you're kind of giving yourself a bit of a neck stretch, right? So you just kind of pull it open like so. So it's like you're pulling these fingers this way and you're pulling these fingers this way, right along the jaw and across the neck. I take my whole palm and I go right across that neck, right? You can even come down below and pull this way, because the next point that I'm going to give to you right here is large intestine 18. So it's kind of on the inside, just underneath here. So just you can going through here, through the neck, and just opening it up is really, really great. Okay, so those are all the ones that are on the head. So now we're going to do the ones on the arms, okay, on the hands and the arms. So we have large intestine 3 and 4. So they're 2 points that are, one's kind of in the finger up a little bit, and the other one's right in this here. Now this is not one that you would want to press if you were pregnant, all right? But if you are not pregnant, just rubbing between these 2 points. Again, you can flip, back and forth, same thing, flip, or you can rub up, just up and down through that crease on both sides, because we have them on both hands. All right, so you get into that little spot there, right between the V, and we rub large intestine 3 and large intestine 4. Okay, now the next one is right at the bottom. If you came and brought your pinky like so, right here is 8, but right here is 7. So we're going to come right down to kind of this side of the hand, and we're going to just rub right here on both hands. Same thing, little figure 8s, little figure 8s. Okay, so give it a good little rub. It's heart 7. Okay, so our pinky is, the meridian comes off the pinky, right? So like I said, if I bent that pinky over like that, I would be heart 8, and then we come down right to here, and it's heart 7. Okay, now on this side of the arm, so you take your fingers like so, and right where my pinky is, basically, is where you're going, and it's going to be right in the center, right like so, right in the center of that wrist, right in the center of the hand. So you've got one right here, and this is what's called circulation sex or pericardium, and it is circulation sex or pericardium or Sanjay channel, and it's 6, the number 6. So directly on the other side is triple warmer 5. Okay, so we sit here and we rub. You can rub these 2 together, right? Just grab your wrists right here, rub. You can again flip back and forth, flip back and forth, right? And you give a rub. I have to swallow a whole bunch right now because it's making spit glands happening here. Ready? So we're going to do it on this side. Same thing. So we take our finger from that wrist down, and it's literally right where that pinky is, and it's in the center, and the one on the outside is your triple warmer 6, and on the inside, right directly on the other side, right here, is circulation sex 5. So we can just rub those together, right? Just rub rub that right in that whole area. Give them a rub. And again, take your hand and flip. You can just hold. Just hold. You could even kind of push on one side and push on the other side to give them, stimulate both of them at the same time. Okay? Now on the arm, and I actually, this is called large intestine 11. So it's actually on the inside. So I actually have a blue spot right here. I had a surgery there, so it's kind of left a little kind of a blood spot there. So it's literally on the side, on the inside of the arm. So you see it's the thumb side, and I'm pushing on that spot right there. And you would do it on both sides. So you can even take your fingers and kind of get right into the crevices like this and just rub. And it's on the outside of the arm, the thumb side, on the inside of the arm, but on the thumb side, right on the crevice there. Okay, that's the large intestine 11. All right. So now we're going to move to the legs. Okay, so I'm going to bring my stool. So the next one we're going to do is what we call is the stomach point, and this is a really, really big point on the stomach channel. This is where a lot of our energies can get stuck in this point, and it's actually a great point to work with every day. So how you find that point is you would take your hand right over top of your knee, and it's again, it's on the outside, so it's on the pinky side of the leg, all right, where your pinky toe would be. Lateral side of your knee, and you're going to come down to the bottom here, and you're going to kind of feel a bone, and you've got a shin bone that's right here, this shin bone that comes all the way up. So you're actually going to try and find the side of the shin bone. You want to get into kind of where the tissue is and just below the knee, and that's where you would go. And so you're going to rub in there, rub. This is actually a really great one. You can even use two hands to rub this. Figure eights. Flip your hands back and forth to take off irregular energies. Flip your hands and just rub. We're going to do that on both sides. Same thing. So we take our hand and we put it over top of the knee. We're going to try and find the bottom of our knee, and then the pinky side. So in other words, this side of that shin bone that runs down, you're going to find that little hollow space that's in there, and you're going to rub. 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 Okay? Perfect. Rub. Figure eights. Okay, so now I'm going to come back up close again, and I'm going to use my little model for this one, okay? So we're going to show the ones that are on the feet. All right, so we have here between our big toe and our second toe, basically right to where you can reach the crease of the toe is liver 3. So we're going to rub in there, rub, and flip back and forth, right? Flip our hands back and forth. We can hold it, all right? And then we would do this on the other foot. So now the next one on the foot is gallbladder 41. So this one's actually up a little bit higher. So it's not right where the web is. You would probably go at least a thumb width higher than where the crease is. So you're going to put your thumb there, and then you're just going to go on the other side of your thumb, and it's literally kind of right where the metatarsals, if you could feel into the flesh, is right here, okay? So that is your gallbladder 41. So we're going to just sit there and again, go back and forth, do little figure eights. All right. Now, behind the ankle, or should I say, this is the big toe side, okay? We're going to go to the big toe side, so the inside of your ankles. All right, so right underneath the ankle is kidney 5. All right, so same thing, rubbing. Now, right behind the ankle is kidney 3. So we're going to rub to where the Achilles are, right in here, and we're going to rub right underneath the ankle bone. Okay, so we have our ankle bone, so it's right underneath the ankle bone, and then back here is where you would find your Achilles, and that's kidney 5 and kidney 3. These two you're going to rub You can do them in tandem just like I did. All right. Now the last one is another one on the leg, and this one's again one of those ones that you wouldn't touch if you were pregnant, but if you're not pregnant, and the way you do this one is you would take that hand just like we did up here to find that triple warmer and circumflex points. This is the triple warmer and the circumflex points. You're going to do the same thing down here. You're going to take your hand to the side of the ankle, and you're going to go through this literally the center of the leg, and you're going to do it on the inside. So it's the big toe side, the middle, like inside of your body. You're going to go on that side. So you're going to take your ankle bone, and then you're going to come right just above it. So this pinky would be sitting on the ankle, like just right on the ankle bone. And then you put your hands like so, go halfway through the leg and come right to the center, and that's your spleen 6. And I think this one would be a really good one to rub, particularly if you've been dealing with cancer, because cancer tends to take its toll on our spleen meridian, our nurture meridian. All right. So there you go. Those are all the spots. All right. You can follow along this video and go through them all, and this is what will help your dry mouth. All right. Give it a try. You can play with one, you can play with all of them. Sort of see which ones. I found the ones on my face when I was doing these ones in particular, the ones in the jaw and through the throat, really got my saliva going. So you give it a try and let me know. If you like this video, make sure you like it below. Okay, take care. Bye.